Hi, welcome to our PowerPoint presentation for N456 epidemiology. Our focus was on the Zika virus. My name is Jamie.
Debbie?
Tricia?
Teresa?
And we're going to be going over some general information with you today on Zika. What is Zika virus? Zika virus is transmitted primarily through the bite of an Aedes species mosquito found in tropical and subtropical areas of the world. It was first identified in the Zika Valley in Africa in 1947. Outbreaks have since been reported in southeastern and southern Asia, the Pacific Islands, and the Americas. Some of the symptoms of Zika include mild fever, conjunctivitis, skin rash, headache, and joint pain. Onset is typically 2 to 7 days after the mosquito bite. 1 in 4 people with Zika infection develop symptoms, and a very small number of people develop complications from the virus. What is epidemiology? The word epidemiology comes from 3 Greek root words. Epi means on, upon, or befall. Demo means people, and ology means the study of. So epidemiology is literally defined as the study of that which befalls people. The mission of an epidemiologist is to break at least one of the sides of the triangle, disrupting the connection between the environment, the host, the agent, and stopping the continuation of disease. What is an epidemiological triangle? It's a model that scientists have developed for studying health problems. The triangle has 3 corners. One corner we have the agent, which is the what of the triangle. The other corner we have host, which is the who of the triangle. And thirdly, we have the environment, which is the where of the triangle. The epidemiological triangle for Zika virus follows. The agent would be the Zika virus itself. The host would be the Aedes mosquito and humans. And the environment would be tropical and subtropical areas.
How does Zika spread? Zika is spread mostly by the bite of an Aedes species mosquito. These mosquitoes bite during the day and night. Zika can be passed from a pregnant woman to her fetus. Infection during pregnancy can cause certain birth defects. Zika can be passed through sex from a person who has Zika to his or her sex partners. Condoms can reduce the chance of getting Zika from sex. Spread of the virus through blood transfusions have been also reported. Complications. Congenital Zika syndrome is a unique pattern of birth defects found among fetus and babies infected with Zika virus during pregnancy. Congenital Zika syndrome is described by the following 5 features. Severe microcephaly, where the skull is partially collapsed, decreased brain tissue with a specific pattern of brain damage, damage to the back of the eye, such as scarring or pigment changes, joints with limited range of motion, such as clubfoot, too much muscle tone restricting body movement soon after birth. Several countries have experienced Zika outbreaks recently, have reported increases in people who have Guillain-Barré syndrome. Risk factors which put you at greater chances of contracting Zika virus are living or traveling in areas where there have been outbreaks and having unprotected sex.
This world map is current as of March 9th, 2018, per the CDC website of areas with risk of Zika virus. The most current cases having been reported in the Bahamas in February of this year. Some additional steps to protect against Zika are wearing long sleeves, pants, and hats, using EPA-approved insectant repellents, sleeping under mosquito nets if overseas or outside, emptying or cleaning containers of standing water, staying in air-conditioned places with screens in good repair, treating clothing or gear with insecticide. The Minnesota Department of Health intervention wheel is comprised of 3 distinct elements of equal importance. First, the model is population-based. Second, the model incorporates 3 levels of practice: community, systems, and individual family. Third, the model identifies and defines 17 public health interventions. We have been asked to write an intervention for each section. The red wedge intervention: track the spread of Zika virus in the U.S. and other countries via the CDC, then update clinical care recommendations as needed.
All right. For the green wedge intervention, we did assist families, individuals, or communities to access the need for individual specialists or resources to help with concerns and further prevent transmission of the disease. Blue wedge interventions include educate individuals, families, and community regarding the facts, knowledge, and attitudes towards Zika virus and patients who may be infected. Orange wedge interventions include developing an alliance with other organizations in your area, like schools, community outreach programs, or churches or other places of worship, to help address health concerns of those in the community. Yellow wedge interventions include collaborating with local, state, and federal officials to respond to the global threat and potential serious consequences of the Zika virus.
What are the determinants of health for Zika virus? We have income and social, anyone living in the outbreak area, personal health, practicing safe sex, wearing insect repellent, and reducing your chances of being exposed to blood. Health services, using the walk-in clinic is necessary, contacting your primary doctor, and utilizing the health department. Biology and genetic. Considering partner to partner, this can be transferred during sex. Intrauterine during pregnancy. We have healthy child. A pregnant mom should restrict her travels to affected areas. Monitoring of mom and child if exposed. Education, so making sure we educate the caregivers regarding a patient who has Zika virus, and also educating the patients if they have Zika, physical environment. So Zika is in the tropical and subtropical areas of the world. So making sure that those patients or those people know how to protect themselves in those environments, and working conditions. So people who are working outside in those climates need to make sure that they're wearing insect repellent, because these mosquitoes bite during the day and night. And social support. So the government needs to get involved in protecting their civilians, giving them whatever they need necessary to make sure they remain safe, utilizing the health department again, and also using their primary physician as a source. Thank you. Please refer to Week 7 forum for comments and questions.